What a beautiful day to enjoy and remember. And as you can see, there's a tennis court behind me. I remember being a pretty good tennis player when I was younger. I can't imagine not remembering the many days I spent on the tennis court. It was really some of my best memories. And our desire really for all of us is to preserve our memories. And this is why I'm making this video. You may have seen my previous video that I recently talked about type 3 diabetes, which is a term that some experts are using to describe dementia. But shortly after I released this video, a new drug for dementia was released by the FDA. And with so many people who are desperate for answers for dementia, I just wanted to provide some perspective so that you can level what your expectations are, but more importantly, better understand, if we should be excited about this new drug. But before I do that, let me introduce myself. Hi, I'm Dr. Hampton, a board-certified family and obesity medicine doctor with a master's in nutrition and functional medicine. I have over 29 years of clinical experience, and my channel is here to help you and your family achieve metabolic health. So let's get to this new drug. In a highly anticipated decision, the U.S. Food and Drug Administration, known as the FDA, approved the early stage Alzheimer's drug called Kisunla, which is a generic name of Donanemab. This makes it the second medicine after Leqembi with a generic name of Donanemab that can slow the progression of early stage Alzheimer's disease. Now, the Eli Lilly drug trial demonstrated that the Donanemab reduces the rate of cognitive and functional decline in patients in the mild cognitive impairment and mild dementia range. Now, to understand how these drugs work, you have to understand what amyloid plaques are. Amyloid plaques are abnormal clumps of protein fragments that form in the spaces between nerve cells in the brain. They are a characteristic of Alzheimer's disease and other degenerative brain conditions and are thought to play a central role in the disease. So essentially, the medicine and its components are amyloid antibodies designed to clear the brain of amyloid plaque deposits that they feel may make cognitive decline caused by Alzheimer's disease occur more quickly. So what did the trial actually show? In a late-stage clinical trial of 1,182 people with early asymptomatic Alzheimer's disease, this medicine slowed cognitive decline by 35% compared to the placebo group and resulted in about a 40% decline in activities of daily living, like driving, managing your finances, and having hobbies. More practically, you get about 7 months of improvement in cognitive function before that decline continues. You'll have to decide yourself if that's long enough. So it sounds pretty promising for those with dementia, but let's talk a little bit more about how these drugs actually work. The underlying biology of Alzheimer's is complex, but does involve the accumulation of abnormal proteins in the brain, beta amyloid, as previously discussed, and tau proteins. These proteins form plaques and tangles, which disrupt communication between brain cells and ultimately can lead to cell death. Most of the drugs on the market for dementia target symptoms of the disease, such as memory loss and cognitive decline, but they do not effectively address the root cause of disease. And by not addressing the root cause of dementia, it's essentially a progressive disease, meaning that it will worsen over time. Additionally, the amyloid plaques that form may be our body's way of trying to address the real issue, which I feel is inflammation. So essentially, we are targeting the symptoms and the consequences of inflammation by targeting the plaques, which is why I believe these new drugs can effectively stop or reverse the damage caused by the inflammation. So I try not to make my videos political, but there's not a lot of money being made by teaching patients how to use lifestyle to reduce inflammation. But I digress. Here's another way we can look at it. When we are targeting amyloid plaques for dementia, right, we may be targeting something that our body is using as its natural defense against inflammation. It's similar to what we're doing by targeting cholesterol plaques for cardiovascular disease. And I want you to answer, how do you think that experiment is going? Did you know that in some studies that nearly 75% of patients hospitalized for heart attacks had cholesterol levels that would indicate that they were not at high risk for cardiovascular disease, yet we spend so many resources and so much money on cholesterol medicines. In other words, in simple language, cholesterol has been shown to be a very poor predictor of cardiovascular disease. And blaming cholesterol is like blaming a fire truck for coming to your house to put out the fire. Cholesterol is like the fire truck. It was sent there to protect your arteries, but sometimes we overprotect them due to ongoing inflammation leading to the buildup of plaque. As a comparison, let's talk about the amyloid hypothesis, which states that amyloid plaques are the primary cause of Alzheimer's disease. But this hypothesis has been criticized for a number of reasons. Number one, plaques don't always correlate with dementia progression, and like cholesterol and cardiovascular disease, is not a perfect predictor of dementia. Many people have a lot of plaques but don't show any signs of cognitive decline beyond normal aging. Number two, amyloid plaques may be the result of other factors. Some researchers believe that plaques are the result of decreased levels of soluble amyloid in the brain, which can be caused by biological, metabolic, or infectious stress. Number three, others have proposed that amyloid is a normal part of the brain's immune system, and that Alzheimer's occurs when the immune system attacks healthy brain cells. So in my eyes, we are barking down the wrong tree, guys. So before I go down any other rabbit holes, let's circle back and talk about the drug itself. So with the level of improvement that was seen by the drug, was there any safety concerns related to using it? Well, I think you know the answer to that. Number one safety concern was with the potential of people who take the drug to experience what's known as ARIA, or amyloid-related imaging abnormalities. This involves the brain swelling or bleeding. Therefore, if you take this drug, your doctor may recommend a MRI to monitor for this potential side effect. Number two, the drug will cost $695 per vial, totaling a whopping $32,000 for a 12-month treatment. Man, that's a lot of dough. Of course, patients' actual costs will depend on their insurance and the length of treatment, but don't worry, I'm hearing through the grapevine that Medicare will likely cover it either way. Number three, it's a monthly IV infusion, guys. Yes, every month you'd have to come in to get the drug administered via IV. Now, number four, for me, this is where the rubber hits the road. The most important issue is that while this drug may help slow cognitive decline, it does not address the root cause of dementia. So let's take a moment to discuss the root cause. Of course, there are many causes of the various types of dementia, but when amyloid accumulates in the brain, it's likely the result of inflammation in the brain. So, if inflammation is the root cause of why we get amyloid accumulation in the first place, wouldn't it be logical to focus on that instead? I think you know where I'm going with this. In fact, whether you agree or disagree, focusing on inflammation is the key. Take a moment to share in the comments to the video your thoughts on this topic. I'm really curious what you guys think. As a metabolic health doc, I'm convinced it's about the inflammation. And there are others who think like myself, like Dr. Georgia Eid, a psychiatrist who believes it's about the inflammation from Harvard, as well as psychiatrist Dr. Chris Palmer and others. We believe that a more effective strategy in adopting a ketogenic diet, whether it's keto or carnivore, which will lower the carbs and increase the healthy fats. And this is a more effective way for individuals to reduce inflammation and their risk for cognitive decline. Ketogenic diets have shown promising results in improving brain health and offers more of a holistic approach to combating dementia. So while I'm always excited to see advances in healthcare giving us additional tools to manage disease, and while the new drugs are certainly a positive development in the treatment of Alzheimer's treatment, it is important that we don't minimize holistic alternative approaches such as a ketogenic diet that may better address the underlying causes of cognitive decline. I believe that medicines can be wonderful bridge therapy that we utilize until we adopt these lifestyle changes. And I want to promise my patients that I'll offer this drug to you if you need it, but no matter what, I want you to walk out of that office knowing that the best way to heal is to adopt a lifestyle change. And with that in mind, guys, I really appreciate you guys coming to this video, because now you know that keto is a more sustainable way to delay cognitive decline and to reverse it, as opposed to 7 months benefit from a drug. So as we conclude, make sure to share this video with anybody you know who they're gonna learn about this drug, they're gonna get excited, but I want them to understand the pros and cons, and I want to make sure they understand that they must think about lifestyle changes first. So I appreciate you, I thank you, like, subscribe, share, and until the next video from the Metabolic Health Doc, continue to be safe, be well, and continue to protect your nest.